Hello and welcome to another edition of the Morning Update live on NTN. My name is Jessie Leonce. If you're just joining us, a special good morning to you. Thank you so much for tuning in. For those of you watching on air, online, residents here in St. Lucia, St. Lucians in the diaspora, we all appreciate you tuning in to ensure that you know what's happening in St. Lucia. And now, time now for the latest developments from the government. Yesterday was observed International Nurses Day. Yesterday was the 12th of May. 2021. Today is the 13th of May. This month is moving faster than April. But anyway, we would like to wish all of the nurses all the best. We'd like to congratulate you on the achievements that you have made in the last year, far surpassing the previous years of the work that has been done, really showing your strength and showing your muscle during this pandemic. We really appreciate it. This morning we will be hearing from the Chief Nursing Officer as well as the President of the St. Lucia Nurses Association. They did provide updates and statements on this year's observance. It is the anniversary, 12th May, the anniversary of Florence Nightingale's birth, and we join the nurses in this special celebration. This morning we will also provide you with updates from the Ministry of Health and Wellness on the COVID-19 front. There are recoveries, new cases to report as well, and we will also let you in on where you can get vaccinated today if you feel so inclined. Also the updates so far in terms of the number of individuals who've gotten vaccinated. In the news for the 24-hour cycle, we have the government repurposing a World Bank loan to support the private sector COVID-19 recovery. Also, COVID-19 in full effect in the schools. We will be hearing from the national epidemiologist as well as the Chief Education Officer, giving us an update on how the education sector has been faring so far since it reopened last month. And an amendment to the Tourism Stimulus and Investment Act is set to benefit stakeholders. So we're going to get into the details of that and more in just a moment. Do stay with us. First, for the morning, we have some inspirational words, words of gratitude to our frontliners. Take a look. Those words of gratitude going out to our frontliners. We do appreciate the work that you continue to do, even within the state, especially within the state of emergency that St. Lucia is in, dealing and responding to COVID-19. We now turn to the observance of International Nurses Day. St. Lucia joined the rest of the region and the world in celebrating International Nurses Day yesterday, Wednesday, May 12th, 2021. As you know, the year of the nurse was extended into 2021, and of course, by the indications of COVID-19, the global pandemic, we've come to especially appreciate the work of the nurses. So nurses are standing proud and tall in their profession for the work that they've been able to do, the indelible effort they have put into this COVID-19 response. We now have a clip from the Chief Nursing Officer speaking on the work that healthcare workers, more specifically nurses, have put into this pandemic in the past year. Mrs. Kurthney Shalmine-Suraj. Take a look.
Internationally, and no different in St. Lucia, nurses are the largest group of healthcare workers and have historically been a huge symbol of healthcare. Their skills and knowledge make them one of the most prominent pillars that uphold our healthcare system. By the nature of the job, nurses have always been on the front line in saving lives, caring for the sick and shutting, guarding our borders, protecting our children and the most vulnerable and at risk, and also educating our families and communities. As we have all witnessed, the health workforce being put to a test this past year as COVID-19 spread across the globe. The pandemic has highlighted the critical role and the importance of nurses within the healthcare sector, and has also highlighted the long-standing problems that remain unresolved. The capacity as well as the competencies of nursing professionals, nursing leadership, as well as working conditions, nursing distribution, allocated resources, and nursing education are all priority areas within the profession that requires urgent attention.
The Chief Nursing Officer went on to indicate that despite all of the focus on COVID-19 and the challenges and limitations caused by this pandemic, the other work programs of the nursing unit continue, and nurses continue to persevere and perform remarkably, adhering to the call of duty to serve. She did go on to make a clarion call to the entire population for their continued support of nurses.
This pandemic has impacted our nurses in situations never seen before, such as working long hours, abuse and victimization by clients, and evolving guidance on how to care for the patients and the virus, compounded by the mass migration of nurses. However, despite all the focus on COVID-19, and the challenges and limitations caused by this pandemic, the other work programs continue, and nurses continue to persevere and to perform remarkably, adhering to the call of duty to serve. This year in particular, this month, we are calling on the public and private sectors for support and action to ensure that our nurses are supported, protected, motivated, and equipped to deliver healthcare at all times, not only during COVID-19. Please, let's rally together and truly show we care by making investments in our frontliners to ensure job security, ensuring appropriate protection and conditions of work, investments in nursing education and professional development, investments in nursing leadership and management, security at work, creation of enabling work environments where nurses can thrive and flourish.
That was Chief Nursing Officer in the Ministry of Health and Wellness, Kurthney Shalmine-Suraj. And she also made special mention of the retired nurses who have come out in their numbers to assist in the COVID-19 response. And one of these individuals is the president of the St. Lucia Nurses Association, Miss Alicia Baptiste. And she did put out a statement also in observance of International Nurses Day, calling and with the hopes that the focus is not lost on nurses, as we've come to be so dependent on them, and their work has been highlighted very significantly in the last year.
Although life as we know it may have changed now to the new normal, the care character of nurses has not. We often talk about how nurses take care of the rest of us and how grateful we are for the extraordinary skill and compassion. More than ever, the rest of us needs to take care of nurses. One such way is to follow the Ministry of Health's protocols to help minimize the virus spread and place less burden on our already overworked nurses. We all depend on the resilience of nurses, the ability to deal with everything being thrown at them and still return the next day or night to do it all over again. We depend on the nurses' conviction, no matter the circumstance, not only to treat us every day with their critical excellence, but also to deliver that care and compassion.
That was the president of the St. Lucia Nurses Association, Ms. Alicia Batiste. And we would like to salute all of the nurses here in St. Lucia and the rest of the world who have really shown themselves out, shown their muscle during this pandemic in helping us in this COVID-19 response. We're going to take a break right now. When we come back, we're going to let you in on the COVID-19 updates, some new cases to report, also recoveries, and in terms of vaccinations, where you can get vaccinated today, also the figures to date. St. Lucians, residents here in St. Lucia are getting vaccinated in droves. Stay with us.
In an effort to ensure patient and first responder safety, the St. Lucia Fire Service has reviewed its patient transfer procedures, especially for patients with respiratory distress. Face masks will be provided. At no time during transportation should the face mask be removed. Please be patient and cooperative during this time to ensure you receive the best possible care while keeping our first responders safe.
Do you know we can limit the spread of the COVID-19 virus? The Ministry of Health is your partner in achieving this solution. Introducing the Amber Wristwatch. The Amber Wristwatch is designed for monitoring daily movements while in quarantine. It provides an accurate location and a precise heart rate. The device is also waterproof and can be worn during all daily functions, like washing the dishes or taking a shower. It's worn like a typical timepiece. The Ministry of Health can now better monitor people in home quarantine and receive alerts of those who do not stay in the confines of their home. A 14-day rental of the Amber Wristwatch is just $75 US. Let us stop the breaches of home quarantine.
Thank you so much for staying with us. This is the morning update live on NTN. We're coming to you from the GIS studios with the latest developments from the government of St. Lucia. We have new cases of COVID-19 to report. On Wednesday, that was yesterday, 12th May, the Ministry of Health and Wellness received confirmation from the Ezra Long Laboratory of 25 new cases of COVID-19. Now, this was out of a batch of 231 samples which were taken on May 10th, 2021 and processed on the 11th of this month. And these individuals were seen at the various community respiratory clinics, nothing out of the ordinary. They were assessed and tested for COVID-19 and asked to remain in isolation pending the outcome. Now, these 25 positive cases, they have been placed into isolation for care at this time, and the contact tracing is now underway for anybody that has been close to them, anybody that they interacted with in the last fortnight or so. The Ministry of Health also received confirmation of the recovery of 13 individuals diagnosed with COVID-19, bringing the total number of active cases in country to 159. And presently, 2 of the active cases, they require critical care at the respiratory hospital. The new cases bring the total number of cases diagnosed in country to date to 4,725. Now, as I mentioned, the St. Lucians are getting vaccinated. At present, we have 25,568 individuals receiving their first dose to date of the Oxford AstraZeneca vaccine, and 15,354 individuals have so far received their second dose. So today, Thursday, May 13th, if you want to get vaccinated, said the health teams will be administering the COVID-19 vaccine at the Darren Sammy Cricket Grounds and the Philip Marsley Grounds from 9 a.m. to 4 p.m. The COVID-19 vaccination drive is catering to everyone 18 and over at this time, as well as if you had your first dose and coming in for your second dose. Now, if you're coming in for your second dose, you are encouraged to carry your vaccination card, which was given to you the first time you got your jab. And if you're coming for the first time, ensure that you pre-register at hmi.govt.lc. If you're not able to, you can let a nurse at your community wellness center, community respiratory clinic, let them know that you want to get vaccinated so that they can pre-register on your behalf. And when you do go to get vaccinated, the day that you decide to go, ensure that you walk with your identification card or some form of ID. Your driver's license will suffice, passport will suffice as well. The ministry continues to remind everyone to please continue adhering to the protocols. We are currently under a state of emergency, and so we hope that you are adhering, you are remaining on the right side of the law as it pertains to observing the 6-foot distance, adhering to the curfews that are being instituted as we go on into this period. We continue with updates from the government of St. Lucia at this time. The government is providing more support to the private sector to mitigate the impact of COVID-19 with the repurposing of another loan. The assistance is being channeled through the St. Lucia Development Bank. We have Lisa Joseph with more.
The COVID-19 pandemic has impacted the global economy at virtually all levels, necessitating government, private sector, and international agency action to mitigate these effects. Small and medium-sized enterprises, SMEs, have been affected on both the supply and the demand side of the economy, creating a crippling cycle. For instance, on the supply side, illnesses, quarantines, and a lack of childcare have reduced the amount of labor resources available to SMEs. At the pandemic's outset, the supply chain was disrupted, causing shortages of raw materials, parts, and goods needed by SMEs to produce their goods or services. The Climate Adaptation Financing Facility, the CAF, has been providing low-cost financing to small and medium-sized businesses since 2017, to help them build resilience to climate change. The Department of Economic Development approached the World Bank to repurpose part of the CAF loan. Claudia Emanuel is the Permanent Secretary in the Department of Economic Development.
So CAF is some $5 million, 4.5 of which is dedicated to financing. And so what would have happened is that with COVID, you would have had a significant negative impact on those small enterprises. Given the lockdowns and the various protocols associated with the pandemic, there would have been a significant loss of business. And so with a view to helping those private sector businesses kickstart their operations, it was felt that the key component or the key requirement would be financing to be able to allow them to do so. And so we thought that as we see internationally, the critical component would have been to provide that support of income that would enable them to get back on their feet.
The part loan, part grant facilities being implemented through the St. Lucia Development Bank. Vincent Boland is the managing director.
We have focused on businesses with people who employ under 5 people in their business, 10 people, small businesses. So they come to us. The challenge that we have been facing with them is that some of these people, their accounting records, their ability to put together their financial statements as well as a business plan tends to be a little more onerous on them. But we have actually started to see how best we can reach out to them and assist them. And we're asking all persons who have made inquiries, who have applied, to come back and speak to us and see how we can together assist you in putting together your business plan, putting together your information that will allow you to access the funding.
Several small and medium-sized businesses have accessed nearly 1 million EC dollars in recovery financing thus far.
The rate is still at a very low introductory rate of 4.5%. The process is that you identify the application form on our website, you download it, you fill it out, and you send it back to us. And that starts the ball rolling. If you can send in your business plan at that same point in time, it's even better. Normal requirement as well is that you have to demonstrate that you have had a 30% reduction in your revenue. For some people that's easy. For others it may not be so easy to show the 30% reduction. Meaning that if you are a small business and you are not necessarily keeping records, we are trying to encourage you to take your little exercise book, notebook, and write down how much money you made over the last year.
The CAF Business Recovery Program received technical and financial support from the World Bank, the Climate Investment Funds, and the European Union through the ACP EU Natural Disaster Risk Reduction Program. From the Government Information Service, Lucia Joseph reporting.
Thank you, Lisa. And meantime, the third term of the academic year is progressing well despite the challenges of COVID-19 and everything that it has posed with the return of face-to-face instruction. And the Ministries of Education and Health continue to collaborate on ensuring a safe environment for learning.
The government of St. Lucia has announced plans to provide incentives, tax relief and exemptions to small property owners in the tourism sector, such as apartments and villas. This is for proposed new and existing projects. The amendment of the Tourism Stimulus and Investment Act will make this possible. The act currently holds a
The United Nations Children's Fund, UNICEF, in a recent report titled COVID-19 and School Closures, stated that the world is facing a COVID-19 education crisis. The report found that schools for more than 168 million children globally have been closed for almost a full year, and with every passing day, these children will fall further behind, and the most vulnerable will pay the heaviest price. UNICEF noted that as the world navigates the second year of the COVID-19 pandemic, no effort should be spared to keep schools open or to prioritize them in reopening plans, as children cannot afford another year of school closures. National epidemiologist Dr. Michelle Fassois, highlighting the importance of in-class instruction, assured that the Ministry of Health and Wellness has implemented the necessary systems that would ensure the health and safety of all students as they continue in the classroom setting.
Generally, children under the age of 18 years present with a very mild disease and represent about 8 to 9% of all cases globally. Locally, this accounts for approximately 9.5% of our cases. Although the World Health Organization reports few outbreaks in schools and believe that the spread of COVID-19 in school settings is very limited, the Ministry of Health and Wellness strives to ensure that our children remain in a safe and healthy environment. As with all sectors, the ministries have collaborated to establish a reporting and response system to manage COVID-19 in schools. Contact tracing is one of the core public health pillars used to break the chains of transmission in infectious diseases. It involves actively looking for the contacts or persons who have been exposed to a COVID-19 case. These persons are then contacted, and based on the level of exposure, a decision is made on whether they should be isolated, quarantined, or made to self-monitor.
Noting several breaches to home quarantine, Dr. Fassois explained that individuals in households with positive COVID-19 cases are not to venture to work or school. Instead, it is advised that these individuals get tested and remain homebound until their results are obtained. Chief Education Officer Dr. Fiona Philip Meyer called on all adults in the community to act responsibly so as to protect the nation's children by adhering to all COVID-19 protocols.
The statistics as per the Department of Health speak to a significant number of adults between the age of 24 to 49 being impacted by the COVID-19. Many of those adults are parents, they're staff members, they're individuals who work within various sectors. And so we encourage our adults to take on the greatest responsibility in terms of protecting and keeping our children safe. We would like to remind all educators that they must continue to adhere to established protocols within the schools. Similarly, we want to ask our parents to be partners with us, to follow the protocols as it relates to in-school activities, but also within their own homes, as per suspected cases, individuals in isolation, COVID-19 positive cases. And one of the major precautionary measures that we want to always undertake is to leave children at home in which a household has been impacted. And we speak to both suspected cases, individuals in isolation, as well as COVID-19 cases. That precautionary measure will definitely help us within the education system.
The Ministry of Health and Wellness and the Department of Education continue to work collaboratively so as to ensure the safety of all students as they pursue in-class instruction. From the Government Information Service, I am Janelle Norville.
Thank you, Janelle, for that report. Of course, in the beginning, we had our wires crossed a little bit. You heard from Herma Demac, but you will hear from her after this break. Do stay with us. You're watching the NTN Morning Update. We're bringing you the latest developments from the government of St. Lucia.
Better yet, use soap and water.
We must protect each other if we are to beat this corona.
Together let us win this war. Be a soldier for St. Lucia. Together let us win this war. Be a soldier, together we can beat this corona.
So you don't become the next case. Avoid touching your face. I'm sure you've been told so. Handshakes and hugging her up, no, no.
Advice give you the please. Cover your mouth and your nose if you cough or sneeze.
Practice social distancing and avoid large social gatherings.
Together let us win this war. Be a soldier for St. Lucia. Together let us win this war. St. Lucia, be a soldier. Together we can beat this corona.
For further information, please contact the hotline at 311 or the Bureau of Health Education at 468-5349.
Thank you so much for staying with us. Businesses in the business accommodation sector, apologies for that, businesses in the tourism accommodation sector are poised to benefit from an amendment to the Tourism Stimulus and Investment Act. Now we hear from Herma Demac.
The government of St. Lucia has announced plans to provide incentives, tax relief and exemptions to small property owners in the tourism sector, such as apartments and villas. This is for proposed new and existing projects. The amendment of the Tourism Stimulus and Investment Act will make this possible. The Act currently holds a requirement for projects of 6-room expansions and above. The announcement was made by Minister for Tourism, Information and Broadcasting, Culture and Creative Industries, Honorable Dominic Fede, at a recent sitting of the House of Assembly.
One of the things or the shortcomings of the Act that we have noted is the fact that the 6-room requirement still stands. And so, Mr. Speaker, we're hoping that with additional legislation we will bring to the House in the coming weeks to ensure that the 6 rooms requirement no longer apply, and St. Lucians who are owners of apartments and villas can qualify for incentives regardless of having 6 rooms or not.
As government hopes to make provisions for small property owners in the coming weeks, Minister for Tourism, Honorable Dominic Fede, shared some of the progress made in the sector under the Tourism Stimulus and Investment Act.
So we saw, Mr. Speaker, a 36-room expansion at Serenity at Coconut Bay. We also saw, Mr. Speaker, that the Act was successful in facilitating incentives for 26-room expansion at Windjammer Landing. Harbour Club, Mr. Speaker, 115 rooms. Royalton, 456 rooms. Villa Zona, 6 rooms. Yellow Sands, Mr. Speaker, 8 rooms. St. Joseph's Limited, 6 rooms. Saul Sanctum, 8 rooms. We also had Francine, 6 rooms. Green Fig Resort, 20 rooms. Villa Poi, 6 rooms. And as well, Mr. Speaker, Progress Palace, some 28 rooms, totaling nearly 670 rooms.
The Tourism Stimulus and Investment Act has been extended for an additional period of 3 years from 1st April 2021 to the 31st of April 2024. From the Government Information Service, I'm Hermity Mark.
Thank you, Herma. Heads of government of the Caribbean Community, CARICOM, are meeting virtually in a special session on Tuesday, 11th May, unanimously agreed to appoint Dr. Carla Natalie Barnett as the 8th CARICOM Secretary General. Dr. Barnett, national of Belize, is the first woman and the first Belizean to be selected for the post. She will replace Ambassador Erwin LaRocque, who is outgoing at this time. Just one second. It's when technology fails you. Yes, so she's replacing Ambassador Erwin LaRocque, who is completing his 2nd term, and she will assume office on 15th August 2021. Former Deputy Secretary General of CARICOM, Dr. Barnett was formerly Vice President of the Belize Senate and has served in various ministerial capacities in her country's government. She has also served as the Financial Secretary of Belize and Deputy Governor of the Central Bank of Belize, as well as Vice President of Operations of the Caribbean Development Bank, CDB. In more appointment news, we have St. Lucian Dr. Hygienist Jean Leon, meanwhile, taking office as president of the Caribbean Development Bank. The seasoned economist will lead a team of more than 200 employees headquartered in Bridgetown, Barbados. And he comes to the assignment with 35 years of experience in economics, financial policy development, and executive management, more than 20 of which were spent working with the International Monetary Fund, IMF. He succeeds Dr. Warren Smith, who retired on April 30th after serving as president for 10 years. We have word from the CARICOM News Time, Tusenkind English Francis. Take a look.
Dr. Warren Smith bid farewell to the Caribbean Development Bank on April 30th, retiring from his position as president. In his farewell engagement with the Board of Directors, Dr. Smith reflected on the successes of his 10-year-long tenure, noting that larger financial institutions are now channeling increased levels of resources through the CDB, giving donors and beneficiaries better value for money. Under President Smith's leadership, membership in the bank increased to 28 members, with Suriname joining in 2013 and Brazil in 2015. The bank established its first country office in Haiti in 2018. Dr. Hygienist Jean Leon took over from Dr. Warren Smith as president of the CDB from the 1st of May.
Tusenkind English Francis from the CARICOM News Time. Now, high on the new president's agenda is supporting CDB's borrowing member countries through the COVID-19 recovery, while advancing the bank's mandate to contribute to the harmonious growth and development of member countries. We are due for another break. When we come back, our final segment of the morning. Stay with us. I forgot, sorry.
to the dentist? Really? How was that? It wasn't bad. The dentist was really nice and she told me that mouth rinsing is very important for healthy teeth. How so? Rinsing with water gets rid of food in between your teeth, which can protect you from getting cavities. No, wait. So after I eat or drink anything, it's a good idea to rinse out my mouth with water? Yes! Make sure to spit out the water after rinsing because swallowing will only bring the germs into your body. Remember, water is an easy and cost-effective way to instantly boost your health and a healthy body to fight many diseases, including COVID-19.
Well, we're coming up to rounding up this morning's update live on NTN. I'd like to thank you so much for watching. Before we leave, we just want to go over the lead stories for today. We had just yesterday International Nurses Day being observed, and we heard from statements coming from the Chief Nursing Officer within the Ministry of Health. That was Mrs. Suraj, and also the President of the St. Lucia Nurses Association, Ms. Batiste. And they were speaking on, the work that the nurses have done in the past year. As you would know, the nurses, the focus on nurses has been extended into 2021 by the World Health Organization. And of course, we've seen the work that nurses have done, and we want to hear from the GIS, extend our commendations to all of the nurses who go above and beyond the call of duty, and to all frontliners who continue to work in our best interest here in St. Lucia. This morning, we had reporting from the Ministry of Health and Wellness, 25 new cases to report and also 13 recoveries. And so these individuals have so far recovered. They're now out and about. We're seeing more and more of that. Persons who have contracted COVID-19 go into the respiratory hospital, are being treated, night and day being attended to. We even heard from one of the patients who'd recovered coming into GIS to speak about, the good care that they received, all going back to the work of our healthcare workers. So that is happening. The COVID-19 response continues to chug on. And speaking of which, we have the vaccination campaign that is happening. Hopefully we can come to ultimately herd immunity here in St. Lucia, so our lifeblood sectors like tourism can come back in very easily. We have some 25,568 individuals receiving their first dose of the vaccine, and some 15,000, a little over 15,000 receiving their second dose of the vaccine. Just want to remind you, if you want to get vaccinated today, vaccinations, the health teams are at the Philip Marsley grounds and at the Darren Sammy cricket grounds today from 9 a.m. to 4 p.m. and they will be administering the vaccines to anybody who's coming in today. So you just have to carry with you your vaccination card if you're going for your second dose, and if you're going for your first dose, before you get there, at least pre-register so that they can know ahead of time who's coming, what the plans are for their day, and how to allocate doses for the day up to the various locations. So ensure that you pre-register online. The site is hmi.govt.lc, and if you don't have access to an online platform, you can let a nurse or a doctor at your community wellness center, the nearest community wellness center, or a community respiratory clinic know that you're interested in getting vaccinated so that they can do so on your behalf. So when you're going to get vaccinated, all you have to do is just carry your identification card with you, or your driver's license, passport, anything that can confirm your identity so that they can put you in the system as having been vaxxed. So and also carry with you some light refreshment. You know how these things go. Sometimes you could be waiting for some time. Just going over the lead stories for the 24-hour news cycle from the government. The government of St. Lucia has repurposed another loan, and it's a World Bank loan in this instance, to support the private sector's COVID-19 recovery. Also, we got an update from the Ministry of Education and the Ministry of Health in terms of how the education sector has been faring and how they've been managing the COVID-19 response within the education sector. We heard from the Chief Education Officer and also from the National Epidemiologist, Dr. Francois, and also the amendment to the Tourism Stimulus and Investment Act is scheduled to benefit stakeholders. So these are the lead stories. We'd like to thank you so much for watching. We encourage you to keep up looking at the NTN Facebook page and also even our Instagram and our YouTube for the updates. Whenever click the notification bell so you know whenever we're going live with an update. It could always be it could be a Prime Minister, the Chief Medical Officer, or us here on a morning, the NTN Nightly at 7 p.m. Nightly. You can tune in for the latest developments from the government of St. Lucia. Know what's happening, because now more than ever before we need to know what is happening considering this COVID-19 situation. My name is Jessie Leonce. I'd like to thank you so much for watching. Do enjoy the rest of your day and keep safe. Adhere to the protocols. Adhere to the 6-foot physical distancing. Wash your hands frequently and use hand sanitizer copious amounts when you're not near a faucet and soap. And also ensure that you carry your mask with you. If you're always forgetting, it happens. You can always keep a quantity of masks in your vehicle, in your bag with you, so that if you have to go somewhere, you're not left wanting or needing. Do enjoy the rest of your day. Cheers. Bye-bye.